The smallest word in that hallway was no, and it almost killed someone. Dr. Harper Lane, a second-year surgical resident, stood at the edge of Trauma 1 like a match held near gasoline. Her auburn hair was pinned so tight it looked stapled in place, and her hands moved with the calm of a metronome, steady, exact, unforgiving. Around her, Chesapeake Harbor Medical Center vibrated with sirens and shouted codes, but she didn't chase the noise. She watched it the way a storm watcher reads the sky. Chief Surgeon Conrad Sutherland stepped in front of her, blocking the door with his badge and his certainty. "You're not cleared for this wing, doctor." Harper didn't argue. She just shifted her weight, and one Secret Service agent noticed the stance first, then the scars, then the quiet discipline in her eyes. His face tightened with recognition. Why would a man trained to protect the president look at a resident like that? "Stay to the end and tell me what city you're watching from." I love seeing how far these stories travel. Now let me bring you into the world of Dr. Harper Lane. The world of Dr. Harper Lane was fluorescent and cold, built from linoleum and locked doors, and it ran on rules people clung to when they were scared. Chesapeake Harbor Medical Center sat a few blocks from the Inner Harbor in Baltimore, close enough that the air sometimes carried a salt bite through the ambulance bay. Inside, the hospital smelled like antiseptic and old coffee, like something scrubbed clean too many times. The third-floor surgical wing hummed with ventilation and quiet footsteps, a steady machine that pretended it could not be surprised. Harper moved through it the way a shadow moves through a doorway. Not timid, not lost, just unclaimed. 34 second-year resident name stitched in black thread above her left pocket. Most people saw that patch and stopped looking. They saw the role, not the person. In the locker room, the other residents filled the space with noise. Tessa Green leaned against a row of dented lockers, phone in hand, eyes bright with the kind of interest that never helped a patient. "Did you see her?" she said loud enough to be heard outside the room. Lane tried to walk into Trauma 1 like she owned the place. Marcus Hall, tall and tired, peeled off a surgical cap and let it dangle from his fingers. Sutherland shut her down in front of everybody. "She did not even blink," Tessa said. "Not a flinch. Not a sorry, sir. Nothing." A first-year resident named Olivia Chen, still carrying the stiff posture of someone afraid to make mistakes, frowned. Maybe she did not hear him. Tessa laughed once. Everyone heard him. He practically yelled. She heard him. She just did not care. Harper never gave them anything to hold on to. No stories, no friends, no after-shift drinks. She showed up early, left late, and spoke only when she had to. Her surgical notes were clean and sharp, like they had been cut out of stone. The rumor was that she had transferred from nowhere. The rumor was that her references were thin. The rumor was that she had to be hiding something because nobody got that steady without paying for it somewhere. Down the hall, a trauma pager chirped and fell silent. Another chirp. Another. Harper did not slow. She passed the lounge without looking in. She passed the board where shift assignments were pinned under curling tape. She turned toward the scrub sinks as if nothing in the building could pull her off routine. Then the overhead speakers cracked to life, sharp and loud. All available trauma staff to emergency. Presidential motorcade inbound. Estimated time of arrival, 2 minutes. Repeat. Presidential motorcade inbound. The surgical wing changed in an instant. Doors opened. Shoes squeaked. A nurse pushed a crash cart so hard the wheels rattled. A tech ran past with a box of sterile gowns pressed to his chest. Someone dropped a clipboard, cursed, scooped it up, and kept moving. Harper stopped at the scrub sink. She turned on the water. Warm. She held her hands under it and watched the stream split around her fingers. 1, 2, 3, 20. Always 20. The habit looked harmless, the kind of ritual every surgeon had, but hers was too exact, too cleanly timed, like a drill. The badge on her chest was still damp from earlier. A thin white line crossed the back of her left hand, old scar tissue, that did not match kitchen burns or a childhood fall. The skin along her knuckles held faint thickening, not from pushing pens, from something rougher. She dried her hands and moved. It took her 90 seconds to reach the emergency department from the 3rd floor. Most residents needed 2 minutes and a complaint about the stairs. Harper moved without wasted motion, sliding around corners, slipping past orderlies, reading traffic like a driver reading a merge lane. The corridor outside Trauma 1 was worse now. The air felt tighter, filled with bodies and sudden authority. Secret Service agents formed a hard perimeter, dark suits and eyes that did not soften. Hospital security stood at the edges with radios clamped to their mouths, trying not to look out of their depth. Chief Surgeon Conrad Sutherland was there in the center of it. Silver hair still neat, jaw set, voice carrying over everything. He pointed a sign corrected. His hands were clean, his confidence absolute. Harper stepped toward the entrance and felt the shift in pressure around her, like she had walked into a room where everyone had already decided who mattered. Sutherland turned and saw her. "You again," he said, not loud but sharp. "I told you." Harper stopped, shoulders square, hands relaxed at her sides. She did not look down. She did not look away. The corridor quieted by a degree. Residents and nurses noticed the stillness first, then the stare. "This requires senior staff only," Sutherland said. "Return to your assigned rotation." Harper's eyes flicked past him, not disrespectful, more like a measurement. Through the glass of Trauma 1, she could see a gurney, waiting, empty straps open. A cardiac monitor powered on. A rapid infuser primed with clear tubing like veins. Someone adjusted the overhead light, and the beam cut across the floor in a clean white blade. She spoke evenly. "I can assist." Sutherland's mouth tightened. "This is the President of the United States. I need experienced surgeons. Not a second year who wants to feel important." Harper's face stayed calm, but something in her jaw locked. It was not pride. It was the tension of someone watching a clock that everyone else ignored. A nurse rolled a tray past them, metal clinking, and Harper's gaze tracked the instruments without thinking. The way her eyes moved looked practiced, not curious, prepared. A Secret Service agent near the wall watched her without blinking. Asian American in his 40s, tall enough to cast a long shadow across the tile. His hands were relaxed, but ready fingers held in a shape that suggested he had trained in rooms where doors came down fast. Faint rope scars ran across his knuckles, pale against tan skin. He glanced at Harper's feet, the way she planted her weight, the angle of her shoulders, the calm center of gravity. Recognition tightened his expression, but he did not speak. Sutherland followed her gaze into the trauma bay and mistook it for eagerness. "You will not be in that room," he said. "Not today." Harper looked at him for a beat, then gave a small nod. Understood. That was all. No argument. No pleading. She stepped back as if she had been dismissed from any ordinary consult. Behind her, Tessa Green whispered to Marcus Hall. "See weird. Who does that?" Marcus shrugged, but his eyes stayed on Harper's hands. The overhead speakers crackled again. Motorcade arriving. The sound hit before the sight did. Tires on pavement outside. Shouts. Radios barking codes. A surge of boots and bodies. The hospital doors at the end of the corridor opened with a gust of winter air and the scent of exhaust. Harper could not see the patient yet, but she could hear the urgency shift from practice to real. Sutherland turned away, pulled toward the incoming storm. "Move," he snapped at his team. "Trauma 1 now. Clear this corridor." Harper stood still as the wall of suits and scrubs surged past her. Her pager vibrated against her hip, a short, impatient buzz. Operating room 3. Scheduled case. Routine. She glanced down long enough to read the name, Linda Brooks cholecystectomy. Gallbladder. A simple procedure, safe, predictable. A resident behind her scoffed quietly. Guess she got what she wanted. Back to the kiddie pool. Harper did not react. She watched the corridor fill with motion, watched Sutherland step into Trauma 1 and vanish behind glass and steel. The Secret Service agent who had been studying her met her eyes for the first time. It lasted only a second, but it was the kind of look that asked a question without words. Harper gave him nothing. She turned and walked away from Trauma 1. Her shoes did not hurry. Her pace did not change. She moved with the same measured control she had at the scrub sink, the same rhythm that did not bend for sirens or status. The surgical wing welcomed her back with its quieter noise. Outside operating room 3, an OR tech waited with a chart tucked under his arm. Jake Morales, broad shoulders, close-cropped hair, eyes that had seen bad days and learned not to blink first. He glanced at the commotion down the hall and then at Harper. "Whole place is going crazy," he said. Harper reached for a fresh mask. "They can." Jake studied her for half a breath, catching something he could not name. "You are not curious. I have a patient," Harper said, and the words landed like a boundary. Through the small window in the OR door, Linda Brooks lay already draped and still under anesthesia. The monitors pulsed a steady green rhythm, a normal heartbeat. A normal day for someone who did not know how close normal could break. Harper placed her hands on the scrub sink handles and turned on the water again. Warm, clear. She began counting. 1, 2, 3. In the corridor behind her, the sounds of Trauma 1 rose sharp and urgent like thunder moving closer. Harper kept her eyes on her hands as the water ran over them, and she did not look back. Harper kept counting as the water ran over her hands, clear and warm, sliding off her knuckles in thin sheets. The sounds from Trauma 1 bled through the vents in broken pieces radio chatter, a shouted order, the sharp chirp of a monitor that did not like what it saw. She did not lift her eyes. She finished her 20 shut the taps and dried with the same slow control, as if speed was something you earned only when it mattered. Jake Morales held the OR 3 door for her with an elbow. "Linda Brooks is asleep," he said quietly. "Vitals are steady." Harper nodded once and stepped inside. Operating room 3 felt like a separate planet. The lights were bright and clean. The stainless steel gleamed. Linda lay draped and still, her face half hidden by tape and tubing, the kind of ordinary patient nobody filmed outside the hospital. A routine gallbladder, a routine afternoon. The monitors showed a steady green wave that looked like permission. The anesthesiologist, Dr. Arjun Mehta, glanced up from his screen. He had the calm posture of someone who had seen panic and refused to catch it. "We are good to go," he said. "Blood pressure stable. No surprises." "No surprises," Jake repeated under his breath as he arranged the tray. Harper took her place at the table. Her eyes swept the field, the marked skin, the line where she would cut. She did not hesitate, but she also did not rush. A surgeon could waste seconds and still look confident. Harper never wasted anything. "Scalpel," she said. Jake placed it into her palm like he had done it 100 times. She made the incision clean and shallow, then deepened it with precise pressure, opening the layers without tearing. The first drop of blood beaded and rolled. Suction whisked it away before it could spread. The rhythm settled in. Retractor, clamp, bovie. Small adjustments, no extra movement. Linda's abdomen rose and fell with the ventilator slow and obedient. Harper exposed the gallbladder and the tissue announced itself immediately. It was inflamed, yes, but not in the way she expected. The scarring was too dense. The color was wrong. The planes that should separate with a gentle sweep of forceps clung like wet paper. Harper stopped. It was not dramatic. The instruments simply held still in her hands. Jake noticed before anyone else. His head tilted just a fraction. "What do you see?" he asked low. Harper did not answer right away. She adjusted the light and leaned in her gaze, narrowing as if she were reading fine print. Her gloved fingers palpated near the cystic duct. There was resistance where there should have been softness, a stubborn firmness that felt like a stone lodged in the wrong place. "Give me a little more exposure," she said. Jake widened the retraction. Harper extended the incision by a centimeter, then another. She did it with the casual ease of someone who knew exactly how much skin would forgive. The gallbladder looked like it had been in a slow fight for months. Chronic inflammation, sure. But this was more than that. The duct anatomy was distorted, pulled, and flattened as if the body had rearranged itself to survive something that did not want to leave. Harper's mind moved fast, but her face stayed calm. She traced the line where the gallbladder met the bile duct. The tissue there had a different texture, a wet fragility like it had already started to come apart. "Stone impacted," Dr. Mehta said from behind the drape, watching the numbers. He sounded casual, making conversation the way anesthesiologists sometimes did when everything was steady. Not just impacted, Harper murmured. She used a fine dissector to tease apart the scarred planes. A thin thread of bile appeared where it should not have been. Greenish, slick, unmistakable. Jake's eyes tightened. That is bile. Harper held still again. One small pause, then another. She shifted the angle and found it the problem hiding in plain sight. A fistula. The gallbladder had eroded into the common bile duct, carving a bad tunnel between structures that were never meant to share a wall. The stone had been sitting there long enough to burn its own path. Pre-op imaging could miss it if the person reading the scan was not looking for rare things in routine cases. If she kept going as a standard cholecystectomy, she could clip the wrong structure, tear the bile duct open, and Linda Brooks would spend the night drowning in sepsis. A simple surgery would turn into a slow collapse. Harper's eyes flicked to the clock. She did not need to do the math out loud. She had done it before in places where clocks were a luxury and time was counted in heartbeats. Jake watched her face. "You are thinking." "I am seeing," Harper said. Her hand lifted toward the phone mounted on the wall, the one wrapped in a sterile sleeve for calls that could not wait. She pressed the extension with the side of her wrist. It rang once, twice, 3 times. On the 4th ring, Conrad Sutherland answered, and his voice came through sharp and stretched thin, layered over other voices and background noise. "What?" Dr. Sutherland, Harper said. Her tone was even almost flat. "This is Dr. Lane in OR3. My gallbladder case has Maritzi syndrome. There is a likely cholecystobiliary fistula. I need approval to extend the procedure. I need hepatobiliary support, or I need authorization to repair." The line went quiet for half a second, long enough to hear a monitor alarm in the background and someone calling a blood pressure. Then Sutherland exhaled hard. "You are calling me during a presidential trauma to talk about a gallbladder. It is not a routine gallbladder," Harper said. "If I follow standard protocol, she can crash post-op." "You are a second-year resident," he snapped. "Do not pretend you are running a transplant service." Harper kept her eyes on the open abdomen. "I am running this table." Sutherland's voice tightened. "Close and convert to a standard subtotal if you have to. Then write it up. I do not have time for this." "She will need repair," Harper said. "Now." "I said I do not have time." There was a click. The line went dead. Jake stared at her over the drape. His hands were steady, but his voice dropped even lower. He hung up. Harper set the phone back into its cradle without looking at it. The room felt smaller. The lights seemed hotter. The hum of the ventilation sounded like a held breath. Dr. Mehta spoke gently, careful not to push. "Do you want me to call for another attending?" "If you call," Harper said, "they will come in here and tell me to stop." Jake's eyebrows rose. "Maybe stopping is safer." Harper's gaze lifted to Linda's covered face for a brief moment, then returned to the wound. The green stain of bile glistened under the surgical light like a warning sign. "Safer for who?" she asked. Jake did not answer. He knew the question was not rhetorical. She was not talking about lawsuits or reputations. She was talking about a woman who trusted them without knowing their names. Harper's shoulders rose with a slow inhale. Her breath stayed controlled, clipped, not emotional. Then she spoke as if she were giving a simple instruction. "Find dissection kit," she said. Jake did not move for a heartbeat. He searched her face for a hint of doubt and found none. Whatever Harper Lane was, she was not the type of person who asked twice. He reached for the kit and placed it on the sterile field. "Here." Harper's hands switched to the finer instruments and the work changed immediately. The movements became smaller, more delicate, but somehow faster. She identified the fistula margins, irrigated gently, and debrided the infected tissue, with a patience that did not feel like hesitation. She isolated the bile duct without tearing it, preserving blood supply in a space where scar tissue wanted to steal it. Her sutures were not the continuous running pattern most residents loved, because it looked neat. She used interrupted stitches, each one placed with a measured bite, tension just enough, then tied down like a promise. The kind of closure you chose when you did not trust the patient to get an easy follow-up when the repair had to hold no matter what. Jake's gaze stayed on her hands. He had seen surgeons in training fumble with fine work hands shaking because the stakes finally felt real. Harper's hands did not shake. They moved like they had done this with worse light, worse tools, and worse odds. Dr. Mehta shifted slightly in his chair. "Everything's stable," he announced, but there was a note in his voice now, not just reporting more like he was watching a magic trick he did not want to interrupt. Harper continued calm and focused. She constructed a secure repair over the fistula site, reinforcing the compromised area with meticulous suturing. When the bile duct looked stable, she irrigated again, cleared the field, and checked for leaks. Nothing seeped. Nothing shimmered green where it should not. Only then did she allow herself to move on. She completed the remainder of the gallbladder removal with a careful, subtotal approach, leaving behind what she could not safely dissect, taking what she could without turning it into a disaster. She worked like someone walking a narrow ridge, not looking down because looking down did not help. The clock on the wall crept forward. 30 minutes. 35. The beeping from Dr. Mehta's monitor stayed steady, and Harper did not look up to celebrate it. She finished in silence, placing the final stitch with a smooth pull, then cutting the suture clean. "Closing," she said. Jake followed her lead, counting sponges, confirming instruments moving with the same crisp discipline she did. When the last dressing went on, Linda Brooks looked no different from any other patient. Still asleep, still taped and draped, still ordinary. Only the people in that room knew how close ordinary had come to becoming a funeral. Harper stripped off her gloves and stepped back from the table. "Post-op protocol," she said to the circulating nurse voice, returning to its normal level. "Monitor for bile leak labs in 6 hours, and I want to see her in recovery." Jake watched her pull off her gown. "You are going to write this up." "I already started it," Harper said. "You are going to get in trouble." Harper turned toward the sink, washing her hands again, the soap foaming white and sliding down her wrists. "I can handle trouble," she said. Dr. Mehta looked at her over the drape. "Where did you learn that repair?" Harper's eyes stayed on the water from doing it right. She dried her hands. The roar from the emergency department felt louder now, as if the building itself had shifted its weight. Somewhere below, the president was still fighting, and the hospital was still pretending it could control chaos with protocols and titles. Harper walked out of OR3 and into the corridor. For a moment, she was invisible again, just another resident in scrubs. Staff hurried past her with charts and blood coolers. A nurse ran by with a portable ultrasound. A security guard barked into a radio. Harper's pager vibrated against her hip. She glanced down. Chief Surgeon Sutherland. "Office." Immediately. Her face did not change. But Jake, standing in the OR doorway behind her, saw her shoulders tighten by a fraction as if a strap had been pulled across her back. Harper slipped the pager into her pocket and started walking toward the administrative corridor. Each step measured controlled as the sound of alarms from downstairs threaded through the air like a warning that would not let go. Harper's shoes squeaked once on the polished floor outside Conrad Sutherland's office, then went quiet. The administrative corridor felt removed from the rest of the hospital as if paperwork could insulate you from blood. The door was open. Inside, Sutherland sat behind his desk with his surgical cap still on shoulders, rigid eyes sharp with exhaustion. "Close it," he said without looking up. Harper stepped in and pulled the door until it clicked. She did not sit. Sutherland finally raised his gaze. "I got a call from anesthesia. Dr. Mehta says you performed a hepatobiliary repair without authorization." Harper's face stayed neutral. "Linda Brooks has a fistula. If I had followed standard protocol, she would have decompensated. I know what Maritzi syndrome is," Sutherland snapped. "I also know what my job is. My job is making sure this hospital does not turn into a circus because a resident thinks rules are optional." Harper's eyes did not blink. "The patient is stable. There were no complications." Sutherland leaned back, studying her like she was a chart he could not interpret. "In 8 months, you have done 40-plus cases, and none of them read like a second-year resident. Your times are too fast. Your hands are too clean. Your technique is not what we teach here." He tapped a pen against the desk once, twice. "Where did you learn to do that repair?" Harper answered with the truth she was willing to give. "I prepare." Sutherland's mouth tightened. "Preparation does not give you muscle memory. A muffled wail of sirens rose from below, then faded. The building seemed to hold its breath. Through the walls, Harper could still hear the emergency department, a distant churn of voices and alarms. Sutherland's phone vibrated on the desk, but he ignored it. He stood and walked around to the front of the desk, stopping a few feet from her. "You were invisible when you started here." That was convenient. "Now after today, you are not invisible." Harper's jaw flexed once, then relaxed. "My job is to operate." Sutherland stared at her as if he wanted to say more, as if the question on his tongue was bigger than training and paperwork. He opened his mouth. The overhead speakers cut in loud and raw. "Code Blue. Trauma 1. Code Blue. Trauma 1. All available surgical staff report immediately." Sutherland went pale. He grabbed the edge of the desk for half a beat, then moved. "Move!" he barked, already yanking open the door. Harper followed 3 seconds behind him. The stairs were crowded with bodies rushing down, but Harper threaded through gaps without touching anyone, a precise line through chaos. The air thickened as they got closer to the emergency department, smelling of sweat iodine and winter air dragged in from the ambulance bay. Radios crackled. A stretcher clanged against a doorframe. Someone cursed, then apologized to nobody. Trauma 1 was a bright box behind glass full of movement. President Michael Harlan lay on the gurney chest, exposed skin gray under the fluorescent lights. A tube ran from his mouth. Leads and lines trailed off him like roots. His eyes were closed, but his brow was pinched as if even unconsciousness could not keep pain out. A nurse called out, voice clipped. "Blood pressure 90/50 and dropping." Another voice. "Heart rate 130. Oxygen saturation 88. Sutherland stepped in like he owned the room. "Portable X-ray now." "Where is cardiothoracic?" A resident answered too quickly. "On the way." Sutherland's head snapped. "On the way is not a time." A Secret Service agent stood near the wall, watching every hand, every instrument, every face. Agent Ethan Park. Harper recognized him immediately. He had been the one in the corridor. Tall, steady eyes trained to evaluate threats, not symptoms. Harper stayed near the door. She did not push forward. She watched. The portable X-ray machine rolled in. People shifted back. The plate slid under the president. The image appeared on the monitor with a flash and a slight delay. The room leaned toward it. Most eyes went to the fragment near the right side of the heart. A small, bright sliver, irregular, lodged close to the right atrium. One fragment, a trauma surgeon said. "Looks stable." Harper's gaze narrowed. The words did not match the picture. The entry trajectory did not line up with where the metal sat now. The path through tissue was wrong. The fragment had moved, and it was still moving. With every beat, the heart tugged at it. With every beat, the sliver kissed muscle it should never touch. Harper watched the monitor beside the bed. The electrocardiogram rhythm had started to wobble, tiny changes that screamed trouble if you had learned to listen. Sutherland pointed at the X-ray. "We need to get him to the operating room. Full setup. Call the cardiac team." A nurse glanced at a phone screen and swallowed. "They are delayed. Streets are locked down." "How delayed?" She hesitated. 20 minutes. Sutherland's face tightened. "Then we wait. We do not open his chest without proper support." The trauma surgeons around the gurney shifted hands, hovering. They did not argue, but their eyes said what their mouths avoided. The president's pressure was falling. Time was shrinking. Harper's fingers flexed at her sides. She could see the fragment's angle. She could see the blood beginning to pool where it should not. The pericardium was turning into a tightening fist around the heart. Tamponade. Minutes. Sutherland kept talking, voice firm, trying to anchor the room with authority. "Increase oxygen. Keep fluids running. Get another X-ray in 5. The monitor beeped faster, as if the machine itself was nervous. Harper shifted her weight a fraction, like someone adjusting, before stepping into a door breach. Ethan Park noticed. His head turned, eyes flicking to her feet, then to her hands, then to her face. He stepped toward her, not aggressive, but not gentle either. He caught her arm just above the elbow, stopping her from moving closer. "Stay back," he said. Harper looked down at his hand, at the rope scars across his knuckles, at the callus on his index finger that came from a particular kind of trigger time. She looked back up. "I am staying back," she said. His grip did not loosen. His eyes studied her, then slid to her stance again, like he could not help himself. "You are not standing like hospital staff," he said quietly. Harper did not answer. Behind them, a nurse called out, voice rising. "Oxygen saturation, 85. Sutherland snapped increase to 15 liters. "Get me an updated estimate." A resident came back, face strained. 18 minutes. Harper's gaze returned to the president. The fragment on the X-ray was small, but her mind filled in the rest. The unseen motion under the skin, the way the metal would drag against muscle, until it tore something that could not be patched fast enough. Ethan Park's voice lowered further. "You see something?" Harper kept her eyes forward. "Yes." "Tell him." She watched Sutherland's hands. They were moving, but not cleanly. There was a tremor, slight, easy to miss if you wanted to believe in him. He was a good surgeon. He was also a surgeon waiting for permission from a clock. The president's blood pressure dropped again. 70/40, the nurse called. Sutherland's face drained. He grabbed the phone and turned away, barking into it, anger and fear braided tight. He listened, then his shoulders sank by a fraction. He turned back to the room. "Cardiac is rerouted. Major accident on the freeway. 45 minutes minimum." Silence hit like a blanket. A trauma surgeon swallowed. "He will not last 45. Sutherland glanced at the monitor, then at the X-ray, then at the president's face. The man on the gurney looked smaller than he should have, the title stripped away by blood loss and physics. Sutherland spoke like every syllable cost him. "Prep him. We do it here." The room exploded into motion. Sterile drapes snapped open. Betadine poured across the president's chest, staining the skin brown. Instruments appeared. A rib spreader clinked onto a tray. Someone shoved a stack of gauze into a nurse's hands. Sutherland stepped into position, shoulders squared. He lifted a marker and drew a line on the chest, the classic approach, the safe approach, the approach that took too long and went through too much. Harper's mouth went dry. The fragment's location required a faster window, a path that avoided unnecessary tissue, a direct line to the pericardial space. She could see it as clearly as if it were drawn on the skin. She took one step forward. Ethan Park tightened his hand again, stopping her. He did not look at her now. He watched the president. His voice was low, almost private. "You know how to do this." Harper's eyes flicked to him. "I am a second-year resident." "That is not what I asked." The president's eyelids fluttered. Sutherland leaned close, voice urgent. "Mr. President, stay with us." The president's eyes opened, unfocused at first, then searching. They found Harper at the edge of the room, not moving, not speaking, just watching with a calm that did not belong in a crisis. His lips moved. No sound. A nurse leaned in. "Can you hear me, sir?" His lips moved again, stronger this time. A thin breath dragged the words out. "Let her." Sutherland froze. "Mr. President, she is not qualified." The president swallowed, face tight with effort. "Let her work." For a second, nobody moved. The words hung in the air like smoke. "Let her work." They were barely audible, a rasp, pulled from lungs that were losing the fight, but they landed heavier than any order Conrad Sutherland had given all day. Sutherland's eyes snapped to Harper. His face tightened as if he could muscle reality back into place. "Mr. President," he said, leaning close to the gurney, voice controlled but urgent. "You need to conserve your strength. We are handling this." The president's gaze did not leave Harper. His mouth opened again. The effort made his throat tremble. "Her," he whispered. A monitor alarm chirped. The blood pressure dipped again. The room did not care about authority. The room cared about physics. Ethan Park's hand loosened on Harper's arm. He did not step away, but he shifted, giving her a path without making it look like permission. His eyes stayed on her face, searching for any sign of hesitation. Harper stepped forward. She did not rush. She did not apologize. She moved like a door opening. Quiet, certain, inevitable. Sutherland lifted a hand, half blocking her. "You cannot possibly think you are prepared for this." Harper met his eyes. Her voice was calm, almost soft. "You are drawing the wrong incision." The words cut through the noise. A few heads turned. Someone stopped mid-motion with a sterile drape in their hands. Sutherland bristled. "Excuse me." Harper looked at the president's chest, then at the X-ray still glowing on the monitor. "That approach takes too long. You will chase the heart through tissue you do not need to cut." One of the trauma surgeons swallowed. "Conrad, her point is." Sutherland snapped his head toward the speaker, then back to Harper. "This is not a teaching moment." Harper's eyes returned to the president's face. His skin had the flat gray tone of someone slipping away. The monitor's waveform flickered with early instability, the kind that became catastrophe without warning. She spoke again this time to the room. "I need a number 10 scalpel, a rib spreader, needle nose forceps, irrigation, a suction hand that does not hesitate." Jake Morales stepped forward from the cart without being asked. "Suction," he said, and his voice had the steadiness of someone who had heard worse alarms. Sutherland stared at Jake, then at Harper, as if the staff were mutinying in real time. His jaw worked. His pride wanted one thing. The monitor wanted another. Ethan Park leaned in close enough that only Harper could hear him. "If you do this, do it clean." Harper did not look at him. "Be quiet," she said, not rude, just factual, as if noise was a contaminant. Sutherland's eyes narrowed, then he made a decision that tasted like ash. "Give her what she needs," he said, and stepped aside. The room shifted around Harper. Someone placed the scalpel in her hand. The metal felt familiar, not comforting, just correct. Harper positioned herself on the president's right side. She checked the monitor one more time, not for comfort, for timing. She placed her left hand on the skin below the rib cage and felt the rise and fall of the ventilator. She adjusted her angle by a breath. Then she cut. The incision was not where anyone expected. Not the classic line across the chest. Harper drew the blade below the rib margin, subcostal, a fast path that avoided the ribs and spared the lung. The skin opened cleanly, the fat layer separated. The fascia gave way with a controlled push. Jake's suction was there before blood could spread. "Retractor," Harper said. Jake placed it. Their hands moved in sync, each anticipating the other. It was not teamwork built in the hospital. It was something older and sharper. Harper opened the field, with minimal trauma, slipping through layers like she knew the map by touch. She found the pericardium. It bulged. A tense, glistening membrane stretched tight by blood trapped inside. It looked like a storm cloud held under skin. Harper's voice stayed even, pericardial window. A nurse near the foot of the bed whispered, "We do not have ultrasound confirmation." Harper did not glance up. "Watch the monitor." Sutherland hovered at her shoulder, hands clenched and empty. His eyes were fixed on her incision like he was trying to predict failure. Harper adjusted the light. She placed the tip of the blade against the pericardium and paused. "Ready on suction," Jake said. Harper made the cut. Blood poured out dark and sudden, a rush that could have panicked a less steady team. Jake caught it instantly, suction-roaring tubing vibrating in his hand. The pericardium deflated by degrees. The monitor responded as if someone had loosened a fist around the heart. The blood pressure climbed 5 points. The heart rate steadied for a beat. Harper did not celebrate. She irrigated. Warm saline flooded the space. She cleared it, watching the heart surface emerge. The right atrium glistened, moving under a thin sheen of fluid. There it was, a bright sliver of metal pressed against the atrial wall, small, jagged, riding the rhythm like it owned it. With each beat, it nudged closer to puncture. A nurse whispered, "Oh my God." Harper's head tilted slightly like a musician listening for tempo. She stabilized the heart gently with her right hand, fingers firm but not crushing. Her left hand extended. "Needle nose forceps," she said. The instrument landed in her palm. Harper did not look at it. She watched the heart. She watched the space between beats. She moved on the pause, the moment the muscle relaxed. The forceps touched the fragment. Harper tested it, a slight pressure, a slight lift, and felt the resistance. The metal had embedded into the myocardium just enough that pulling straight would tear tissue and make a bleed the room could not control. She needed finesse. Harper spoke to anesthesia without taking her eyes off the field. "This will drop his pressure when I mobilize it. Have vasopressors ready." Dr. Mehta answered instantly, standing by. Sutherland's lips parted about to question, but Ethan Park's stare pinned him silent. The agent had stopped watching the room. He watched Harper's hands. Harper began to work the fragment free the way you remove a splinter from a fingertip, rotating to release the grip before you pull. Rotate, lift, pause. Rotate again. The heart beat under her fingers strong and struggling. The fragment shifted a millimeter. The blood pressure dipped. 70/30, the nurse called. Vasopressor going in, Dr. Mehta said. Harper kept her hands steady. She did not fight the heart. She moved with it, reading its rhythm, making the fragment follow her, not the other way around. Rotate. Lift. The metal edged out another millimeter. A thin line of blood welled at the contact point. Harper irrigated with her free hand as if she had 3 hands. Keep suction tight, she said. I am on it, Jake replied, voice flat and focused. Ethan Park stepped back half a pace and pulled out his phone. His thumb moved fast, scrolling, tapping, searching. His eyes flicked between the screen and Harper's hands as if matching a pattern. Harper did not notice, or she did and refused to give it oxygen. The fragment resisted at the last moment, embedded on one sharp corner. Harper adjusted her angle, rotated the forceps slightly, and eased it away from the tissue. The blood pressure dipped again. 68/29, the nurse called. Harper's voice stayed calm. Hold. She waited through a beat. Through another. The heart surged, then softened. Now, Harper lifted. The fragment came free. It was so small. 5 millimeters rough edged a tiny, ugly sliver that had nearly stopped the heart of the most protected man in the country. Harper placed it in the specimen tray without looking. Metal clinked against stainless steel. The sound was strangely loud. She immediately inspected the extraction site. There was oozing, not catastrophic bleeding, but enough to matter. Cautery, she said. Jake placed the instrument. Harper sealed 2 tiny vessels with quick precision. The oozing stopped. She irrigated again and watched for pooling. Nothing. The monitor steadied. The blood pressure climbed. 85/50, the nurse announced, and her voice cracked with relief. Dr. Mehta exhaled, rhythm stabilizing. Sutherland stood, frozen eyes locked on the open wound and the calm hands inside it. His authority had nowhere to stand. There was only outcome. Harper placed a drain carefully and began closing the pericardial window sutures quick and clean. She closed layers with the economy of someone who had done this too many times to waste motion. Behind her, Ethan Park found what he had been looking for. A photo grainy, taken in harsh light. A masked surgeon in fatigue's eyes, visible above the fabric, focused on a patient outside the frame. He looked up from the phone and spoke quietly, as if saying it too loudly would shatter something. Major Lane. Harper's hands did not stop, but a tension moved through her shoulders, small and sharp, like a muscle remembering pain. You are mistaken, she said. Ethan's voice stayed steady. Helmand Province. 3 years ago. You operated on men from my unit after an ambush. Sutherland's head snapped toward Ethan. Agent, what are you talking about? Ethan did not look at him. Her name was not in our paperwork. They listed her as classified personnel. But I remember the voice. I remember the hands. Harper tied off a suture and cut it. I am Dr. Harper Lane. Ethan took another step closer, still not interfering. And you are the surgeon who told my team to stop praying and start applying pressure. Harper's jaw tightened. He lived because he applied pressure. Ethan nodded once, almost respectful, almost grateful. They all lived because you would not accept losing them. Sutherland stared at Harper as if her face had changed shape. Who are you? Harper finished the final layer of closure, dressed the wound, and stepped back from the gurney. Her gloves were streaked faintly red. Her eyes were clear. She looked at the team. ICU monitoring for 24 hours. Watch for effusion and arrhythmias. Chest imaging in 6 hours. Maintain drainage output measurements. The nurse nodded rapidly. Yes, doctor. Harper pulled off her gloves and dropped them into the biohazard bin. The simple sound of latex snapping seemed to break the spell. The president's eyes were open again, weak but present. He looked at Harper the way someone looks at the person who just pulled them back from a cliff. Thank you, he whispered. Harper held his gaze for a beat. Rest, she said, and it was the closest thing to gentleness in her voice. Sutherland stepped in front of her path as she turned toward the door. His face was tight voice, low, almost angry, almost shaken. You do not walk away after that. Harper looked at him. The patient is stable. This was the president. He is a patient, Harper replied. Ethan Park shifted, not blocking, just placing himself where Harper had to acknowledge him. His voice was quiet, controlled. Dr. Lane. Harper's eyes flicked to him. For the first time since she had entered Trauma 1, her expression wavered by a fraction, not fear, not guilt, something closer to a warning. Ethan held her gaze without flinching. I know what I saw. Harper reached for the door handle. Then keep it to yourself. She opened the door and stepped into the corridor, leaving behind the bright room, the stunned silence, and a small piece of metal in a tray that proved how fast a life could change when the wrong word is said in the wrong hallway. The corridor outside Trauma 1 felt louder after Harper left it, even though the alarms were muffled by glass and distance. People stared in quick, stolen glances that slid away the moment she met them. A nurse pushed past with a cooler marked blood and nearly clipped Harper's shoulder, then mouthed an apology without slowing. Harper kept walking. Her hands smelled faintly of chlorhexidine. Under the scent, something metallic still clung to her memory, the taste of adrenaline that did not care what your badge said. She turned toward the recovery unit, moving through the surgical wing like she had a map in her head, and no time to explain it to anyone. At the nurse's station outside post-anesthesia care, a charge. Nurse looked up and froze, as if she had not expected Harper to be real. Dr. Lane, the nurse, said, voice tight. Your patient is in Bay 4. Harper nodded and stepped into the curtained space. Linda Brooks lay under warm blankets, cheeks pale, mouth slightly open. The monitor showed a steady rhythm. A bag of fluids dripped at a measured pace. Her chest rose and fell, calm, unbothered by the disaster she never saw. A recovery nurse adjusted the pulse oximeter and glanced at Harper with the caution people used around a rattlesnake they had not decided was dangerous. She's stable, the nurse said. Pain controlled, no nausea. Harper leaned in, checked the dressing, pressed gently around the incision to feel for swelling. Her touch was precise, almost tender. Linda's brow twitched, a small sign of discomfort through sedation. Any drop in pressure, Harper said, call me. Any sign of bile, leak, abdominal distension, fever, call me. The nurse nodded quickly. Yes, doctor. Harper turned to leave, but a voice caught her in the hallway. Dr. Lane. Arjun Mehta stood near the doorway, still in his anesthesia scrubs, hair damp at the temples. He looked like a man who had spent the last hour watching a tightrope walker cross without a net. You did the right thing, he said low enough that only she could hear. Harper's expression did not change. She'll live. Mehta's eyes held hers. That repair your hands, that is not something you learn from reading. Harper looked past him toward the elevator doors. The hospital noise rolled around the corner like surf. She's stable, she repeated, and it sounded like a boundary more than reassurance. Mehta hesitated. Sutherland is going to come for you. Harper's gaze flicked back. Let him. She walked out. The residence lounge was on her route back toward emergency, and the door was cracked open. Voices spilled out sharp with excitement and fear. I heard she cut into the president, Tessa Green said, and her voice had the thrill of gossip dressed up as concern. I heard she took over like she owned the room. That is not possible, Olivia Chen replied. Secret Service would not allow it. You know what else they would not allow? Marcus Hall said a resident doing a bile duct repair without an attending. But she did that too. Harper passed without stopping. The voices died as if someone had pulled a plug. Tessa stepped into the hall phone in her hand like it was a weapon. Dr. Lane. She called too sweet. Is it true? Harper did not slow. Is it true you have patients waiting? She said. Tessa's smile faltered. We all have patience. Then take care of yours. Harper rounded the corner and headed for the stairwell. Halfway down, she felt a presence behind her. Not close enough to touch, close enough to be real. She glanced back and saw Ethan Park on the landing above one hand, resting lightly on the rail, posture, relaxed eyes tracking her in the way people tracked exits. He did not speak. Harper kept moving. The emergency department doors opened into a wall of sound. Radios, voices, footsteps, a portable ventilator whining as it rolled past. Security posted at the entrance scanning badges with nervous efficiency. The air smelled of wet wool coats and disinfectant and something bitter that always arrived when too many people were afraid at once. Harper slipped into a trauma gown and tied it behind her back in one motion. A triage nurse looked up. "We are full," she said, as if Harper were there to ask permission. Harper scanned the bays. "Who is dying first?" The nurse blinked, then snapped into focus and pointed. "Trauma 2 is holding a critical from a pileup on Interstate 95. Ambulances are stacking." The overhead speakers crackled. "Trauma alert. Multi-vehicle collision on Interstate 95. Multiple patients inbound. All available personnel report to emergency." The words barely finished before the ambulance bay doors banged open. A gurney slammed through, pushed hard by paramedics whose faces were flushed from cold air and panic. The patient on the stretcher was a man in his 30s, shirt cut away, chest bruised in the shape of a steering wheel. His eyes were wide lips, blue at the edges, breathing shallow and fast. "Male 32, a paramedic shouted. Steering column impact. Decreased breath sounds on the left. Saturation dropping." Harper was at the bedside before the gurney stopped rolling. Her eyes took in the chest rise, the neck veins, the trachea's slight shift, the way the man fought to inhale and failed. "Tension pneumothorax," she said, and it was not a guess. Olivia Chen appeared at her shoulder, hands hovering, waiting for instruction. "Should we get imaging?" Olivia asked. "He will be dead before the portable arrives," Harper replied. She turned to the nearest nurse. 14-gauge needle. Antiseptic. Local. The nurse hesitated. "Doctor, we need an order." Harper's gaze snapped to her, not angry, just sharp. "That is the order." The nurse moved. Olivia swallowed. "Where do you want me?" "Hold his arm. Do not let him sit up." The patient tried anyway, panic lifting his shoulders. Harper pressed him down with a steady hand and leaned close enough for him to hear her. "Look at me," she said. "You are not dying right now. You are going to feel pressure. Then you will breathe." His eyes clung to hers like a lifeline. The nurse returned with the needle. Harper cleaned the skin fast, found the second intercostal space by touch, and inserted the needle with a controlled push. Air hissed out immediately, a sharp release like a tire puncturing. The man gasped, then drew a deeper breath that actually filled his lungs. The monitor climbed, numbers rising like someone pulling a drowning head above water. Olivia's eyes widened. "Saturation is coming up." "Chest tube setup," Harper said. "He needs drainage and a scan for internal injuries." The nurse nodded, already moving. Harper stepped away, as if she had finished a routine task. The man's eyes followed her, confusion and gratitude mixing on his face, but Harper had already turned toward the next bay. A woman in her 20s came in on another gurney, blood pouring from her mouth and nose, face distorted by trauma. Her oxygen saturation was dropping in fast, ugly jumps. Dr. Nolan Price pushed in from the side, sleeves rolled, voice loud and confident. "I've got airway." He positioned himself at the head and tried to intubate. The laryngoscope went in. He fished for the cords. Blood flooded the view. He pulled back, cursed under his breath, tried again. The saturation dropped to 70, Dr. A nurse warned. Price tried a third time, jaw-tight stubbornness masquerading as control. Harper watched for 1 second, then 2. She could see the pattern. She could see the failure. "We need a surgical airway," she said. Price did not look up. "Give me a second." "There is no second," Harper said. He tried again anyway. The saturation hit 65. The woman's chest movements became smaller, desperate. Harper reached for a cricothyrotomy kit on the cart and opened it with clean, fast motions. A nurse's hands trembled as she held gauze. Price glanced over, irritation flaring. "What are you doing?" "Saving her," Harper said. "This is my patient." Harper's eyes stayed on the woman's neck. "Move." Price hesitated, and in that hesitation, the monitor screamed. Harper stepped in, took the scalpel, and made a small incision through the skin. She palpated the landmarks with her gloved finger, found the membrane cut cleanly through, and inserted the tube in one smooth motion. She connected the bag valve mask. Air flowed. The woman's chest rose in a full breath. The saturation climbed. 70, 75, 80. A nurse let out a sound that was half sob, half laugh. Price stared at Harper as if she had slapped him. That was inappropriate. Harper did not look at him. She secured the tube with tape. "She is oxygenating," she said. "Write your complaint." She moved on. In the corner of her vision, Ethan Park stood near the doorway, still watchful. He was not in anyone's way. He was not helping. He was simply there, eyes following Harper's hands as if they were evidence. Tessa Green appeared again, face flushed from running hair escaping her cap. "Harper," she blurted, forgetting titles in her rush. "They are saying you saved the president." Harper turned her head just enough to look at her. "They are saying a lot of things," she said. Tessa's mouth opened, hungry for more. Harper's voice cut it off. "Get into Bay 5. Start vitals. Do not stand here." Tessa hesitated, then moved. Another gurney arrived. A man with a head laceration, pupils uneven. A teenager with a seatbelt bruise across the abdomen, skin pale and damp. A woman clutching her side, breathing shallow. The emergency department became a conveyor belt of pain. Harper moved between bays like a conductor voice. Steady eyes, scanning hands, making decisions faster than other people could process. 2 large-bore IVs. Now. Call radiology. We need CT. Type and cross. Get blood ready. Press here, hard. Do not stop. Olivia trailed her, trying to keep up. "How do you know which one first?" she asked, breathless. Harper did not slow. "Look for the one who is lying quietly," she said. "Quiet is not calm. Quiet is failing." A teenage boy on a gurney near the wall was too still. His lips were pale. His eyes tracked the ceiling with a detached, frightened stare. Harper stepped to him and placed 2 fingers on his wrist. The pulse was fast and thin, like a thread pulled tight. "What is his pressure?" she asked. A nurse checked and swallowed, 70/40. Harper's gaze dropped to the bruising across his abdomen. Seatbelt sign. Internal bleeding until proven otherwise. "Call surgery," the nurse said. Harper's eyes flicked up. "I am surgery." She looked toward the operating room board at the desk. Red lights marking rooms occupied, procedures in progress, time slots stacked like dominoes. The boy's skin had the waxy look of someone losing blood faster than they could replace it. Harper's jaw tightened. She leaned closer to the boy. "What is your name?" His lips moved, voice thin. "Tyler." Harper nodded once. "Tyler, listen to me. Keep your eyes on my face." His eyes locked on hers, wide and terrified. Behind her, Ethan Park stepped closer, quiet as a shadow. Harper did not turn, but she felt him. The emergency department lights flickered slightly as another ambulance arrived, and the room filled with fresh voices, fresh panic, fresh problems. Harper stayed with Tyler, one hand on his wrist, counting the pulse in her fingertips, while the hospital around them churned and the weight of too many lives pressed in at once. Harper kept her fingers on Tyler's wrist and felt the pulse thinning fast but weak, like it was trying to escape her touch. 2 large bore lines, she said. Pressure bag on fluids. Type and cross for 6 units. Now. A nurse hurried to obey. Olivia Chen stood at the foot of the gurney, eyes flicking between Tyler's face and Harper's hands. Tessa Green hovered 2 steps back, caught between wanting to help and wanting to watch. Tyler's pupils tracked Harper, glassy and frightened. His breathing came in shallow pulls. The bruise across his abdomen was ugly, a dark band that looked like someone had cinched him with a belt made of concrete. Tyler, Harper said low, close enough that he could hear her over the noise. "Do you feel like you need to throw up?" He swallowed, then nodded once. Harper's jaw tightened. "That is not nerves." She looked up at the trauma nurse. "Bring the ultrasound." The nurse wheeled it in, hands moving faster now. Harper took the probe, pressed it to Tyler's upper abdomen, and watched the screen. Black fluid collected where it should not be. A dark crescent near the spleen. Another pocket near the liver. Free fluid. Blood. Olivia's voice shook. "That is a lot." Harper did not answer. She pulled the probe away and wiped gel off Tyler's skin. "He is bleeding internally." A paramedic nearby heard and turned. "We can take him to CT." "He does not have time for CT," Harper said. Dr. Nolan Price pushed in from the side. Face flushed from the airway case, eyes sharp with irritation that had not cooled. What do you mean, he does not have time? We need imaging. Harper looked at Price, then at Tyler's monitor. The blood pressure flashed again. 68/38. You want a picture of him dying, Harper said. Or you want him alive? Price bristled. I am not taking orders from a resident. Harper's voice stayed flat. Then listen to the monitor. The nurse called out, pressure is dropping. Harper pointed to the blood cooler that had just arrived. Hang the first unit. Wide open. A nurse hesitated. We need a physician order. Harper's eyes cut to her. I am giving it. The nurse moved. Price stepped closer. If you push blood without confirming source and get it wrong, you will drown him. Harper leaned in toward Tyler's face, watching his eyes flutter. He is not drowning. He is emptying. Tyler's lips moved. Am I going to die? Harper's expression softened by a fraction, just enough to be human. Not if I get you upstairs. She straightened and looked toward the operating room status board across the department. Red lights everywhere. Names, case types, timestamps. A schedule that assumed emergencies arrived politely. Harper walked to the desk and scanned it, then looked at the OR coordinator. How soon can I have a room? She asked. The coordinator, a woman with tired eyes and a headset, shook her head before she finished speaking. All rooms are occupied. The next one clears in 20 minutes. Harper turned her head slowly. Which room? Or 4, the coordinator said. They are closing an appendectomy. 20 minutes. Harper felt the words settle into her body like a weight. She looked back at Tyler. His chest rose and fell in quick, shallow motion. His skin had the damp sheen of shock. He did not have 20 minutes. Price crossed his arms. You cannot bump cases. There is a system. Harper's eyes stayed on the board, then slid to the far end of the room where Ethan Park stood near the entrance, quiet, watchful. He had not spoken since the cricothyrotomy. He had simply been there like a shadow that did not belong to the hospital. Harper walked straight to him. Ethan's gaze narrowed slightly as if he had been waiting for her to choose this. You said you wanted to talk, Harper said. His eyebrows lifted. That is one way to start. Harper's voice dropped. I need an operating room in 5 minutes. Ethan glanced past her to Tyler, then back. That is not how this works. Harper held his eyes unblinking. It cannot be. Ethan's jaw flexed. You are asking me to pull security authority inside a hospital. Harper's tone did not change. I am asking you to keep a teenager from bleeding out in front of you. Ethan looked at her for a long beat, then nodded once, crisp. Show me the coordinator, he said. Harper led him to the desk. The OR coordinator started to speak polite and defensive, then stopped when she saw Ethan's badge and the posture behind it. Ethan did not raise his voice. He did not need to. This is Special Agent Ethan Park, he said, and the words carried weight like a loaded firearm carried weight. Protective detail. I need immediate OR access for an emergency laparotomy. Override current scheduling. The coordinator blinked. Sir, we cannot just override the board. Ethan leaned slightly closer. Yes, you can. Price stepped in, outraged. This is absurd. You do not get to run medical operations because you have a badge. Ethan did not look at Price. He kept his eyes on the coordinator. Call whoever clears or priorities. Right now. The coordinator swallowed and pressed her headset. Or control. This is Jenna at the board. I need a supervisor. A voice crackled back, irritated. Ethan held up a hand and Jenna handed him the headset as if it burned. Ethan spoke into it, calm and precise. I am invoking Protective Emergency Protocol. Authorization code Alpha 79 Victor. I need OR1 cleared immediately. A pause. Ethan listened, eyes steady. Harper watched his face, reading the shift in the muscles around his mouth as the resistance on the other end melted. Ethan handed the headset back. OR1 is clearing now. You have 8 minutes. Harper did not thank him. She simply turned. Tessa, she said, voice sharp enough to cut through the noise. Get transport. Olivia, call anesthesia and tell them we are coming now. Blood is already running. Bring it. Olivia nodded and sprinted. Tessa moved, finally useful. Price stepped into Harper's path. His face was red. You are going to get every one of us sued. Harper looked at him the way she had looked at Sutherland earlier, like he was a problem, not a person. Move. Price hesitated. Ethan's voice came from behind Harper, low and cold. Doctor, step aside. Price glanced at Ethan, then back at Harper, and something in his expression shifted. Not respect. Recognition of force. He moved. The gurney rolled. Harper walked beside Tyler, one hand on the side rail, the other checking the bloodline, adjusting the flow. The first unit was nearly in. Tyler's eyes drifted, then snapped back open when Harper spoke. Stay with me, she said. He swallowed. It hurts. I know, Harper replied. Keep breathing. They cut through corridors that seemed suddenly too long. Nurses ran alongside with a cooler. An orderly pushed hard wheels rattling. The hospital blurred into bright walls and swinging doors. Ethan matched Harper's pace on her left, just close enough to be present, not close enough to interfere. He watched Tyler once, then shifted back to Harper, as if Tyler's condition was a fact, and Harper was the variable. You used that ultrasound like you were checking a map, Ethan said quietly. Harper kept her eyes forward. That is what it is. Ethan's gaze stayed on her hands. You did not hesitate. Harper did not answer. They reached the elevator. A nurse pressed the button. It took too long. Ethan stepped forward, palmed the security panel, and the doors opened faster. The nurse stared. Harper did not. Inside the elevator, the noise dropped away, replaced by the soft hum and the beep of Tyler's monitor. Tyler's eyes were half closed now. His breathing was shallow. Harper checked his pulse again. Thready. Second unit, she said. A nurse hung it with shaking hands. Ethan watched the nurse, then looked back at Harper. His voice softened by a fraction, almost careful. Kandahar is not Helmand, he said. But the report I read says Helmand Province 3 years ago. Convoy ambush. You were the surgeon. Harper's fingers tightened on the rail. Do not. Ethan held her gaze. 3 died. The elevator dinged. The doors opened on the surgical floor, bright and cold. Harper pushed the gurney out without waiting for the nurse to steer. Her voice sharpened again, clipped and focused. Or 1, she said. They moved down the hall. The OR doors were open. Staff hurried, setting up trays, adjusting lights. A scrub tech threw a gown onto a table. Someone called for more suction tubing. The smell of betadine hit Harper like a memory. Conrad Sutherland appeared at the end of the corridor, moving fast, eyes locked on the gurney. His cap was skewed, his face tight with the strain of the day. What is this? He demanded. Harper did not slow. Teenager. Internal hemorrhage. Positive fast. Hypotensive. Needs exploration now. Sutherland's eyes flicked to Ethan. Why is Secret Service in my operating suite? Ethan's voice was controlled. Room was cleared under emergency authority. Sutherland's jaw clenched. He stepped beside Harper as the gurney rolled into the OR. You are operating. Harper looked at him. Unless you want to waste time arguing. Sutherland's gaze locked on hers. He saw something there he did not understand. Something that did not belong to a second-year resident. He swallowed his pride hard enough that his throat moved. Scrub in, he said sharply to the team, then to Harper lower. Do not make me regret this. Harper turned to the scrub sink and started washing. 20 seconds. Always 20. Ethan stood at the edge of the doorway, watching her hands as the water ran over them. I know why you moved the way you did in Trauma 1, he said, quiet enough that only she could hear. I know what that stance means. Harper kept her eyes on the water. This is not the place. Ethan's voice stayed steady. Then tell me where it is. Harper shut off the taps, dried her hands, and reached for the gown without looking at him. Her mouth tightened. Not now. Behind her, Tyler's monitor beeped faster, the sound thin and urgent, and the OR lights flared brighter as the team moved into position. The OR doors swung shut, and the noise of the emergency department fell away, replaced by the bright hum of lights and the steady insistence of machines. Tyler Reed lay on the table, skin wax pale under the surgical lamps. The bruising across his abdomen looked darker now, like ink spreading. Dr. Mehta stood behind the drape eyes on the monitor's, hands already moving through medications with quiet speed. Pressure is 52/30, he called. Heart rate 160. A scrub nurse finished tying Harper's gown. The fabric snapped into place against her shoulders. Harper stepped to the table and looked down. Blood pooled fast, dark and heavy, filling the field as if the body were pouring itself out. Suction cleared it, then the cavity filled again. The kind of bleeding that did not negotiate. Nolan Price was already there, gloved hands inside the open abdomen. His face had lost its swagger. The muscles around his mouth twitched as he fought to keep control. "I cannot find the source," he said, voice tight. "The spleen is torn. I clamped it, but it keeps filling. It keeps filling." Harper leaned in and watched the blood for one breath. Not the amount. The color. The way it surged. The way it returned even when suction stayed ahead of it. "Retract the bowel," she said. Price shook his head. "This is splenic. Retract it." Harper repeated, sharper now. "Left side. Pull everything medial." Price hesitated, pride flickering even in panic. Sutherland stood at the edge of the room, near a stainless steel cabinet, arms crossed, face pale, under the cap. He had not spoken since Tyler rolled in. His eyes stayed fixed on Harper's hands like he was watching a stranger use familiar tools. Price finally moved, dragging loops of intestine aside with a retractor. The field opened deeper. Harper's gaze dropped into the retroperitoneal space, the dark back wall of the abdomen where bleeding hid and killed. There, a torn left renal vein, ragged and pumping, spilling blood into the cavity in a thick, relentless stream. The injury sat just far enough back that a less experienced surgeon could miss it just close enough to the aorta that one wrong move could end everything. Harper did not raise her voice. She did not need to. "Vascular clamps," she said. 2. And 4-0 proline. The scrub nurse's hands shook as she passed the clamps. Harper's hands did not. She placed the first clamp proximal, then distal, isolating the tear. Blood stopped in an instant, as if someone turned off a faucet. The cavity looked suddenly unreal without the flood. Tyler's pressure ticked up by a few points. 58/35, Dr. Mehta called. "Still critical." "Push blood," Harper said. The second unit flowed. The monitor held its thin line of hope. Price exhaled hard, staring at the clamped vessel. "How did you see that?" Harper did not look at him. She leaned closer, inspecting the tear. 3 millimeters, jagged edges, vein wall thin and fragile. The kind of repair that punished arrogance. "You were looking where you wanted the problem to be," she said. "Not where it was." Price's jaw clenched. He swallowed whatever he wanted to say. Harper took the needle driver. The first stitch had to be perfect. Too tight, and the vein would shred. Too loose, and the leak would return, and Tyler would be gone before anyone could speak his name. She placed the needle with a steady wrist, rotated through tissue, pulled the suture through in one smooth motion, and tied it down with controlled tension. The thread kissed the vessel closed without strangling it. One stitch, then another. The room settled into a new rhythm, quieter, focused. The kind of focus that made time feel different. Sutherland shifted a step closer, drawn by the way Harper moved. He had seen master surgeons operate with precision, but there was something else in her work, a compact economy that felt like it came from scarcity. As if she had learned to treat every second like it belonged to someone else. At the doorway, Ethan Park appeared again. He stayed near the wall, out of the sterile field eyes, scanning the room with the same protective discipline he used in the trauma bay. But his attention kept returning to Harper's hands. Harper placed a third stitch. A fourth. The tear began to close, edges meeting the vessel wall holding. "Better," Dr. Mehta called. 64/40. A scrub tech adjusted the lights. The beam tightened on the repair, bright enough to show every fiber of tissue. Harper's hands worked in millimeters. Price watched in silence, the earlier anger replaced by something more complicated. He looked like a man realizing he had been standing next to a fire he did not understand. Harper placed stitch 5, then 6. Sutherland spoke low, almost unwilling. "Where did you learn vascular repairs like that?" Harper did not answer. The question hung there anyway. Harper placed stitch 7. Then she paused with the needle hovering, eyes locked on the tissue. Ethan's voice came quietly from the wall. "Helmand Province." The words landed like a hand on a bruise. Harper's shoulders tightened just a fraction. The needle stayed steady. Ethan continued calm but firm. Convoy ambush. 3 years ago. You were the surgeon. Sutherland's head snapped toward Ethan. Agent, this is not the time. Ethan did not look at him. He looked at Harper. You left after that. Harper drew the next stitch through, tied it down, cut the suture clean. Do not do this, she said, voice flat. Ethan's tone softened. You have been doing it to yourself for years. Harper's hands moved again. Stitch 8. Stitch 9. The repair held clean and strong. Tyler's pressure rose another few points. Systolic is 70, Dr. Mehta called. Not good. Better. Harper checked the vein wall and saw no leak. She was not done. She removed the clamps slowly, watching the repair as blood flow returned. A thin line of red appeared at the edge of the stitch. Harper placed a 10th stitch without hesitation, a reinforcing bite that sealed the ooze before it became a problem. The leak stopped. She held the field still for a breath. No pooling, no surge. The repair stayed quiet. Only then did Harper speak again, and when she did, it sounded like she was reading facts off a page she hated. You want to know why I left, she said. Sutherland stayed silent. Price did not move. Even the scrub nurse seemed to stop breathing. Harper's eyes never left Tyler's open abdomen. Her hands returned to the splenic injury, ligating vessels with quick precision. It was Helmand, she said. We got 9 wounded at once. Different vehicle types, different levels of injury. 3 were critical. 6 were serious, but stable. Her tone remained steady, but something underneath it tightened like a wire pulled taut. I made a call, she said, and tied off a vessel. I prioritized the one with the best chance of survival. Tension pneumothorax and hemorrhagic shock. I stabilized him. He lived. She moved to the torn spleen. The organ was shredded, not salvageable. She worked without drama, controlling bleeding, preparing for removal. While I was operating, Harper continued. 3 others were with medics. Good medics. They did what they could, but they did not have my hands. Ethan's eyes narrowed. He did not interrupt. Harper's fingers tightened on an instrument. By the time I got to them, 2 were gone. The 3rd died while I was still closing. Price's face changed. The defensive anger drained out of him, leaving a stark attention. This was not gossip. This was confession. Harper's voice stayed controlled, almost cold, because warmth would break her open. They were young. 19, 21, 23. She lifted the damaged spleen, separated it cleanly, and placed it into a basin. The movement was precise and final. Their names, she said, and for the first time, her voice wavered, barely like a breath catching. Landon Briggs, Mateo Rivera, Kira Kim. Sutherland swallowed, his hands unclenched at his sides. Harper irrigated the abdomen. Suction cleared the fluid, and the cavity looked clean again, deceptively calm. I told myself it was the right call, Harper said. I told myself I saved who I could. But I knew what those injuries were. I had seen them before. I knew I could have reached one of them in time if I had chosen differently. Ethan's jaw tightened. You cannot carry every outcome. Harper did not look up. I can carry what I did. She inspected for additional bleeding, checking the liver edge, the bowel mesentery, the pelvis. Everything looked controlled now. She placed hemostatic material where needed. The abdominal cavity stayed quiet. Dr. Mehta's voice cut in steady. Pressure is 82/50. Heart rate 110. He is stabilizing. The words should have felt like relief. Harper's face did not change, but her shoulders dropped by a fraction, as if a strap had loosened. She began closing, layer by layer. Fascia, first strong bites, even spacing. Subcutaneous tissue. Skin. Price stood slightly back now, no longer trying to lead, no longer fighting for the center. His eyes remained fixed on Harper's hands. There was no accusation left in his posture, only the unsettling recognition that he had been wrong about her. When Harper tied the final knot and cut it, Tyler's abdomen was sealed, dressings placed, lines secure. The monitor beeped in a steadier rhythm. Harper stepped back from the table. For the first time in the room, she looked tired. Not weak, not shaken, just tired the way someone gets when the adrenaline clears and reality returns. ICU, she said to the circulating nurse. Monitor renal function. Watch for compartment syndrome. Labs in 6 hours. The nurse nodded rapidly. Yes, doctor. Sutherland moved closer, stopping a few feet from Harper. His face was tight, but his voice had changed. Less command, more strain. You just did vascular repair under pressure that some of my senior surgeons would not attempt without a full team, he said. You confessed to a battlefield decision that still eats you alive. And you are standing in my operating room as a second-year resident. Harper pulled off her gloves, fingers flexing as if they ached. My title is not the point. Sutherland's eyes held hers. It is when you keep pretending it is all you are. Ethan stayed at the wall silent now, as if he understood that pushing further would fracture something. Harper reached for the door, ready to leave the room that smelled like iodine and blood and memory. Sutherland's voice stopped her. My office, he said, now. Conrad Sutherland did not wait for Harper to change out of her gown. He met her in the scrub room doorway, face-tight eyes too awake for a man who had been running on adrenaline since the motorcade hit the curb. Tyler's gurney was already rolling toward ICU, the monitor tone steadier, now the blood warmer in his cheeks. A nurse jogged beside the stretcher, one hand pressed to the IV line, as if she could hold the pressure up by willpower alone. Sutherland pointed down the hall. My office. Now. Harper stripped off her gloves, washed and dried. 20 seconds. Always 20. She followed without arguing. The surgical corridor had a different energy than emergency. It was still busy, but the chaos was contained behind doors. Here, people whispered. They watched Harper pass with the kind of staring you did when you wanted to ask a question, but were afraid of the answer. Ethan Park walked a few steps behind them, not escorting, not trailing, just present. His eyes scanned corners, doorways, reflections in glass. Harper noticed the habit without thinking the way he placed himself, so he could see and move. Sutherland's office smelled like paper and stale coffee. A desk crowded with folders, a framed diploma, a neat row of textbooks arranged like decor. He shut the door, then turned and looked at Harper as if he were seeing her for the first time. Sit, he said. Harper stayed standing. Sutherland's jaw tightened, but he did not push it. He went to his computer, tapped keys with quick, angry precision, and pulled up a file. The light from the screen made the strain under his eyes look deeper. I got your operative note, he said. Bile duct fistula repair, renal vein reconstruction, and before that, a pericardial window on the president. Harper's face stayed calm. He is stable. Sutherland turned the monitor so Harper could see it. Not her note. Something else. A personnel record. Her name sat at the top in clean black letters, Harper Lane. Below it, a series of lines that did not look like hospital credentialing. The formatting was different. The language was different. There were blocks of text blurred by redaction. Sutherland watched her eyes. I called in favors, he said. I should not have had to. You applied here with thin references, clean exam scores, and a history that read like a blank wall. I assumed you were a quiet resident who wanted to work. He leaned closer to the screen and scrolled. You have more trauma exposure than anyone on my staff, he said, voice lower now, less sharp. It is not even close. Harper did not move. Sutherland's finger stopped on a line that was not fully redacted. His mouth tightened. Combat Surgical Unit. Special Operations Support. Multiple deployments, he read. He looked up. Hundreds of cases in field conditions. Ethan's voice came from the corner by the door. She was classified support. We did not get names. We got outcomes. Sutherland snapped his head toward Ethan. You brought this here. Ethan held his gaze. I recognized her. Sutherland turned back to Harper. You let this hospital treat you like a second-year resident with 8 months of experience. I am a second-year resident, Harper said. Sutherland's laugh was short and humorless. That is a title. It is not what you are. Harper's eyes hardened. I came here to finish training. Civilian training. Sutherland pointed at the screen. You have been doing procedures my senior attendings would not touch without a specialist. You are not learning how to keep your hands steady. You are learning how to pretend you do not already know. Harper's jaw flexed. You wanted me in my lane. I stayed in my lane. Sutherland's expression shifted at that. A flicker of shame or anger, hard to tell which. He opened his mouth to answer and stopped when there was a knock at the door. Not a timid knock, a firm one, like someone used to doors opening for them. Ethan's posture changed instantly, shoulders squaring, eyes sharpening. He crossed to the door and opened it. A woman stepped inside in a dark uniform with 2 stars on her collar. Her hair was cut short, gray, threaded through brown, her face lined in a way that spoke of long nights and hard decisions. She carried a folder tucked under her arm, thick stamped in red with warning labels. Sutherland straightened as if a wire had been pulled through his spine. General. The woman's gaze went past him straight to Harper. Her eyes did not soften. Major Lane, she said. Harper's body went rigid. It happened before her face could stop it, the kind of reaction that lived in muscle memory. Her shoulders squared, her chin lifted. Her breath turned shallow. I am not a major, Harper said carefully. Not anymore. The general stepped closer and stopped a few feet from her. You will always be one to me. Ethan closed the door behind her, then stood to the side, silent, watchful. His eyes never left the general's hands. Sutherland looked between them, still trying to find the floor in a room that had tilted. General Evelyn Hart, he said, as if the name might make this make sense. We were not expecting. General Hart did not look at him. You were not invited, she said. You were informed. Sutherland swallowed and nodded once subdued. General Hart turned the folder in her hands. You left because of Helmond, she said to Harper. You left because you believed you made the wrong call. Harper's throat moved. That is not your concern. It is my concern, Hart replied, voice steady, because it was my command and you were one of my surgeons. Hart placed the folder on Sutherland's desk. The sound was heavy. Final. I came because you are carrying a lie, she said. Harper stared at the folder. Her hands stayed at her sides, but her fingers curled slightly as if she were resisting the urge to grab it or knock it away. Sutherland cleared his throat. If this is classified, it should not be here. General Hart finally looked at him. Her gaze was flat. It is here because the president nearly died today, and the person who kept him alive has a name. That name is already moving through the wrong channels. Sutherland's face tightened. He glanced at Ethan, then back at Hart. Ethan said quietly, people talk. Even with guns in the room, Hart nodded once, then slid the folder toward Harper. Read, she said. Harper did not reach for it. General Hart's voice softened by a fraction. Harper, read it. The use of her first name broke something. Harper's hand lifted slow and touched the folder as if it might burn. She opened it. Inside were pages of typed reports, witness statements, photographs, maps marked with routes and times. The kind of paperwork that looked clean while describing chaos. The top page held a heading and a date. Harper's eyes moved across the lines. Her breathing changed, catching slightly. Her hand tightened on the paper. Sutherland leaned forward, unable to help himself. What is it? General Hart answered without looking away from Harper. The report she read after Helmond was sanitized. It was written to protect people who did not deserve protection. Harper turned a page. There was a section with names. Not Tyler. Not Linda. Names from a different world. Her fingers trembled as she traced them as if touching ink could touch the dead. She swallowed hard. It says the ambush was deliberate. Hart finished. Set up. Harper's eyes snapped up. That is impossible. Hart's gaze did not move. It is not impossible. It happened. Harper looked back down, reading faster now. The page described a supply officer assigned to medical logistics. A man Harper had reported weeks before the ambush for stealing medical supplies and selling them on the black market. A complaint she had filed, documented, ignored. Hart spoke in a measured tone, like someone laying out evidence in a courtroom. He had connections. He had protection. When you reported him, he retaliated. He compromised the route. He fed the convoy's location to the wrong people. He arranged the timing to maximize casualties. Harper's mouth opened and closed without sound. Her eyes kept moving, scanning lines as if she could outrun them. There was a subsection on weapons recovered. Armor-piercing rounds not typical of local insurgents. A statement from intelligence. A series of redacted names that still carried the weight of confirmation. Harper's grip on the page tightened until her knuckles whitened under her skin. Sutherland's voice came out rough. "Are you telling me those 3 soldiers?" Hart's eyes finally flicked to him. "Were targeted," she said. "Their vehicle was hit first. Their injuries were catastrophic before they reached the aid station." Harper shook her head once sharp. "No." Hart stepped closer. "Harper, listen to me." Harper's voice broke through thin and angry. "I was there. I saw them." "You saw what arrived," Hart replied. "You did not see what happened on that road. You did not see the first impact. You did not see the rounds tearing through armor." Harper looked back down, reading the medical timeline. Times, distances, notes from medics, vital signs recorded on the move, a blunt line in the report that made her breath stop. Non-survivable injuries prior to surgical contact. Her hands started to shake. Not the controlled tremor of fatigue. Something deeper. Ethan took a small step forward, then stopped, respecting space the way he respected a weapon. His voice was quiet. "So she could not have saved them." Hart nodded, "Not the way she thinks." Harper's eyes flooded, not with tears spilling, but with wetness that made everything blur. She blinked hard and kept reading anyway. There was another page. Court-martial proceedings. The supply officer's name. Evidence. A chain of communications. A conviction. A sentence. Harper's mouth moved. "Why was I not told?" Hart's voice softened, and the hardness in it turned to something like regret. "Because the investigation was above your clearance. Because people wanted the story to disappear. Because it embarrassed the wrong offices." Harper stared at the pages, and for a moment, the room seemed too bright. She swallowed and spoke, voice barely above a breath. "I left because I thought I killed them." General Hart's eyes held hers. "You left because you believed what they needed you to believe. You needed a reason that made sense, and they handed you one." Harper's shoulders rose and fell, once a shaky breath she could not control. Her hands were still shaking. Sutherland's face had changed completely. The arrogance was gone. The certainty was gone. He looked like a man watching his own assumptions crumble. "You saved the president today," he said, voice low, almost stunned. "You saved a teenager in my operating room. You saved your gallbladder patient by doing what I refused to authorize." Harper's eyes snapped to him, sharp and raw. "Do not." Sutherland stopped, then nodded once, the closest he could get to apology without saying the word. "Fine," he said. "Then hear this. We need you. This hospital needs you." Harper looked away. "I do not want a title. You do not get to disappear," Sutherland replied, and his voice was not cruel. It was tired. "You cannot keep letting people with less experience make slower calls while you stand in the doorway." Harper's throat moved. She looked at the folder again, at the lines that had stolen years of sleep from her, at the proof that her guilt had been built on a lie. General Hart placed a hand on the edge of the desk, steadying the moment. "You deserve the truth," she said. "Not because it erases loss, because it ends the wrong story." Harper's eyes closed for a beat. When they opened, they were glassy but clear. Ethan spoke quietly. "You were not wrong to leave," he said, "but you do not have to keep punishing yourselves." Harper looked at him, then back at the folder. Her hand smoothed the top page, once a small gesture that looked like she was trying to flatten reality into something manageable. From somewhere down the hall, a code alarm sounded distant but urgent. The hospital never stayed quiet for long. Harper inhaled slow, then exhaled through clenched teeth. She closed the folder carefully and set it on Sutherland's desk. Her hands were still trembling. She looked at Sutherland. "My patient in ICU needs monitoring," she said. "And the emergency department is still full." Sutherland held her gaze. "This conversation is not finished." Harper's eyes moved to the door, then back to General Hart. "Thank you," she said, and the words looked like they cost her. General Hart nodded once. "Stop carrying what was never yours." Harper turned, reached for the door handle, and paused for a fraction of a second, as if deciding whether she could still move forward with shaking hands. Then she opened the door and stepped back into the hospital's noise, heading toward the place where decisions were made in seconds and titles mattered less than outcomes. Harper pushed through the double doors into emergency, and the noise hit her like heat. A paramedic shouted for a bed. A nurse called out a pressure. Someone cried behind a curtain, the sound thin and private. Harper moved straight into it, letting the chaos take what it wanted from her hands, because her hands knew what to do, even when her mind was still holding a folder full of truth. Where she asked the charge nurse, and the nurse pointed without questions now. Harper worked until the edges of the day blurred. She stopped a bleed. She rechecked an airway. She walked a new resident through compressions without raising her voice. When the ambulance bay finally slowed, she stood at the sink, scrubbing again, watching soap spiral down the drain as if it could carry guilt with it. Ethan Park waited near the wall, like he belonged to the building now. "You are shaking less," he said. Harper kept her eyes on the water. "It is a long day." "It was a long 3 years," Ethan replied. Harper dried her hands. The tremor was still there, faint, but it no longer owned her. She looked up, and for the first time since he had said Helmand, her expression was not a warning, it was tired honesty. "I believed the wrong story," she said. Ethan nodded once. "You believed what you were given." A nurse stepped out from behind a curtain. "Dr. Lane, the president's team, wants an update." Harper's jaw tightened. "He is stable. That is the update." The nurse hesitated. "They want to speak with you." Harper started to answer, then stopped when Conrad Sutherland appeared at the end of the hall. He looked different now. Still rigid, still proud, but the sharpness had been filed down by what he had seen. He walked up, without an audience, without performance. "My office," he said, quieter this time. Harper held his gaze for a beat, then followed. General Evelyn Hart was already inside, standing near the window. The late afternoon light made her uniform look almost black. She turned when Harper entered, eyes steady. Sutherland shut the door and did not waste time. "I have a board meeting in 40 minutes, he said. "They want explanations. They want liability reports. They want control." Harper stayed standing. "Then give them paperwork." Sutherland huffed a short laugh. "That is the problem. Paperwork is all they understand." He stepped closer, voice lower. "I cannot undo how I treated you earlier, but I can stop this hospital from wasting you." Harper's eyes narrowed. "I am not a resource." "No," Sutherland agreed. "You are a surgeon who makes rooms move." He took a breath, like the next words cost him. "I am offering you chief of trauma." Harper did not blink. "No." Sutherland's expression tightened. "You did not even let me finish." Harper's voice stayed calm. "I do not want a title. I do not want a spotlight. I came here to learn civilian medicine. I came here to be normal." General Hart's gaze stayed on her face. "Normal is not the goal in trauma," Hart said softly. "Useful is." Harper's jaw flexed. "I am useful on a table, not in meetings." Sutherland leaned forward. "You saved the president inside my trauma bay. You kept a teenager alive inside my operating room. You did it while my attendings hesitated." Harper's eyes flashed. "You mean while they followed rules you taught them?" Sutherland flinched, then nodded once. "Yeah." Silence sat between them for a moment, thick and honest. Harper looked at Hart, then at Ethan. Ethan's face was still, but his eyes carried something careful, like he was giving her room to choose without pushing. Harper inhaled slowly. "If I accept," she said, "I do it my way." Sutherland's eyebrows lifted. "Define your way." Harper's voice turned sharper, not loud, just clear. "No delays for ego. No waiting for permission when the patient is crashing. No hiding behind titles when seconds matter." Sutherland stared at her, then nodded. Agreed. Harper kept going. "I want a program for veterans who already know pressure, who already know blood, who already know what it means to make decisions with bad information. Medics who come home and get told they are not qualified to do anything." General Hart's mouth tightened with approval. Ethan's eyes flicked to Sutherland, watching his reaction. Sutherland hesitated, then exhaled. "The board will fight that." Harper's gaze was steady. "Then fight them." Sutherland looked at her for a long beat, then spoke like a man making peace with a loss that was also a win. "Done," he said. "Build it." Harper's shoulders dropped slightly, as if some internal weight finally had a place to go. General Hart stepped closer. "You are not going back," Hart said. Harper's lips pressed together. "I am not going back to Helmand," she replied. "I am staying here." Ethan nodded once, almost imperceptible. Sutherland extended his hand. Harper looked at it, then shook it. Her grip was firm, controlled, not friendly, but real. That night, she went back to Linda Brooks first. Linda was awake now, eyes blinking slowly as Harper stepped into the recovery bay. Her voice was hoarse. "Doctor." Harper leaned in. "You did fine." Linda's brow wrinkled. "My daughter said something went wrong." Harper glanced at the dressing, then at Linda's face. "Something tried to go wrong," she said. "We did not let it." Linda swallowed. "Thank you." Harper nodded once. "Rest." She checked Tyler in ICU next. He was pale, but alive tubes and lines everywhere, monitor steady. A nurse adjusted the drip and looked up. "I have never seen anyone move like that," the nurse said quietly. Harper's eyes stayed on Tyler's face. "Keep his pressure up," she replied. "Call me if anything changes." She left the ICU and walked the halls as if she were learning them again. Same walls, same lights. But the air felt different, like the building had finally noticed who she was. 6 weeks later, the 4th floor held a room that had not existed before. A trauma simulation lab, bright and clean with 4 bays monitors, mannequins and carts stocked like a battlefield that had been organized by people who hated waste. The smell was new paint layered over antiseptic. 15 people stood in a line facing Harper. Men and women, late 20s to early 40s, shoulders squared, eyes watchful. Some had tattoos that disappeared under sleeves. Some had hands marked by old cuts. All of them carried the quiet alertness of people who had seen bodies break. Sutherland stood at the back, near the door, arms crossed, watching without interrupting. Ethan leaned against the wall beside him, suit jacket open, earpiece, gone posture, still protective. Harper walked in front of the line, gaze moving from face to face. "This is not residency," she said. "This is a bridge." A man with a buzz cut swallowed. "How fast?" 18 months, Harper replied. "If you are good, if you work, if you stop lying to yourself about what you can handle." A woman near the center lifted her chin. "Name's Cassie Moore," she said. "Former Navy corpsman." Harper nodded. "Why are you here, Moore?" Cassie's eyes did not drop. "Because I am tired of watching people hesitate." Harper moved to the next. "You." A man with haunted eyes. "Derek Shaw." "Army medic." "Why?" Harper asked. Derek's jaw tightened. "Because I keep seeing the ones I could not save." Harper held his gaze. "Then learn to save the next one," she said. She turned to the group. "Civilian medicine teaches caution. Caution is useful. Caution also kills when it turns into delay. You will learn precision. You will learn teamwork. You will learn when to act before you are comfortable." Sutherland shifted behind her, and for a moment, Harper heard his earlier words echo in her mind. "Not cleared for this wing." She let it go. Harper pointed to the first bay. A mannequin lay there with a chest rise programmed shallow and fast. The monitor screamed a low oxygen saturation. "Show me tension pneumothorax," Harper said. Cassie stepped forward without waiting. Her hands moved over the chest, finding landmarks by touch. She inserted the needle. The mannequin released a sharp hiss of air. Harper watched, expression unreadable. "Good," she said. "Now do it faster." Cassie's mouth tightened, but she nodded. They ran drills until sweat darkened scrubs, until voices turned hoarse, until the line between old instincts and new standards started to blur into something useful. Sutherland approached Harper during a brief reset. His eyes were steadier now. "The board asked me why we are doing this," he said. Harper did not look away from the bay. "What did you tell them?" Sutherland's mouth twitched. "I told them the truth, that a president is alive because a woman they would have kept out of the room knew what hesitation costs." Harper's throat moved. She looked at the trainees again, then at the monitors, then at the carts. "Keep them honest," she said. Sutherland nodded. "I am trying." Ethan stepped closer, voice low. "The president is requesting a visit." Harper's expression tightened. No. He wants to thank you, Ethan said. Not a camera, not a speech. Harper exhaled slowly. He can thank the team. Ethan's eyes held hers. He asked for you. Harper stood still for a moment, then turned back to the trainees. A monitor alarm chirped, and Cassie called out vitals like she had done it 100 times in sand and smoke. Harper listened to the cadence, the shift from fear to control. A door opened at the far end of the lab. President Michael Harlan stepped inside with 2 agents behind him, walking carefully but steady suit, crisp face, fully colored again. He looked at the mannequins, the carts, the line of veterans then at Harper. He stopped a few feet away. Dr. Lane, he said. Harper did not smile. She did not bow. She simply nodded. Mr. President. He held her gaze. You gave me my life back. Harper's voice was quiet. I did my job. He shook his head. You did it when other people were still deciding what they were allowed to do. Harper's jaw tightened, but she did not argue. The president looked past her to the trainees. What is this? He asked. A program, Harper said. A way to stop wasting people who already know how to keep someone alive. The president nodded slowly. It is a good thing. Sutherland stepped forward, cautious. We are expanding. With federal support. The president looked back at Harper. Approved, he said simply. Harper's eyes narrowed. Approved. He nodded, funding is signed. A sound moved through the room. Not applause, more like a collective exhale. Cassie Moore's eyes shone. Derek Shaw swallowed hard and stared at the floor for a second, as if he needed to steady himself. Harper looked at them, then back at the president. Her voice stayed controlled. Thank you. The president held out his hand. Harper took it. His grip was warm human, nothing like the title that had filled the hospital with suits. When he left, Harper stood in the lab for a moment, listening to the familiar hum of machines and the quieter sound of people learning. Her pager vibrated. Trauma alert. Harper turned toward the door without hesitation. Ethan watched her go. Sutherland watched her go. The trainees watched her go. Harper did not run from who she was anymore. She ran to the work. If you are still here, comment the city you are watching from. Hit like if you want more stories like this and subscribe so you do not miss the next one.